Welcome to the overview of what to expect when you get the COVID-19 vaccine. My name is Dr. Lakeisha Butler, and I'm a pharmacist and clinical professor at Southern Illinois University Edwardsville School of Pharmacy. In December of 2020, the United States started the most ambitious vaccination campaign in our nation's history. Just 9 months later, more than 180 million Americans are fully vaccinated against COVID-19. But we need your help to reach the goal of having the greatest number of Americans vaccinated as quickly as possible, so that we can get back to doing all the things we stopped doing because of the pandemic. COVID-19 vaccines are safe and effective, and they will protect you, your loved ones, and those most vulnerable against COVID-19 illness. The Centers for Disease Control and Prevention, also known as the CDC, recommends that all Americans get vaccinated for COVID-19 as soon as they are eligible. 3 vaccines are currently recommended in the United States to prevent COVID-19. The vaccines from Pfizer, BioNTech, and Moderna are mRNA vaccines that require 2 doses. You are considered to be fully immunized 2 weeks after your second dose. And the Johnson & Johnson Janssen vaccine is a viral vector vaccine that requires only 1 dose. And you are considered to be fully immunized 2 weeks after that dose. Getting the COVID-19 vaccine is no different from getting many other vaccines. Here are a few tips that will make the process even easier. The COVID-19 vaccine is administered in the deltoid muscle, which is the big muscle in your upper arm. If possible, wear clothing that allows easy access to your upper arm. For example, consider wearing a short-sleeved or sleeveless shirt, either alone or under a sweater or jacket that can be easily taken off. The vaccine can be administered into either the left or the right arm. Your arm might be sore after the shot, so many people decide to get the shot in their non-dominant arm, which is the one that you don't write with. But other people might decide to get it in their dominant arm because they're more likely to move that arm more, which can actually help to lessen the pain. If you usually sleep on your side, you might want to get the shot in the opposite arm. Staying hydrated by drinking water before getting the vaccine can also be helpful, especially if you tend to get nervous or dizzy when you get a shot. One thing that is not recommended is taking an over-the-counter pain reliever or antihistamine to try to prevent those vaccine-related side effects or allergic reactions. We don't have a good understanding of how these medicines might affect how well the vaccine works. However, if you take any of these medicines regularly for other reasons, you should keep taking them before you get vaccinated. You can take a pain reliever after your vaccination if you have pain, headache, or body aches. When you get the vaccine, both you and the person administering the shot will need to wear a mask. It has to cover your nose and mouth. In addition, if you are in a busy location, you will need to practice social distancing by staying 6 feet away from other people. You should receive a paper or electronic version of a fact sheet that tells you more about the specific COVID-19 vaccine that you receive. Each authorized COVID-19 vaccine has its own fact sheet that contains information to help you understand the risk and benefits of receiving that specific vaccine. It is natural to be concerned about whether the shot will hurt. A very small gauge needle is used to deliver the COVID-19 vaccine. And many people who have been vaccinated say they barely felt the needle going into the muscle in their upper arm. It's important to be aware of some of the side effects that are possible after you get the COVID-19 vaccine. There are a number of more common side effects that are normal signs that your body is building protection against the virus that causes COVID-19. You may have pain, redness, or swelling in the arm where you got the shot, or you may experience flu-like symptoms such as muscle pain, tiredness, nausea, chills, fever, and a headache. These side effects may affect your ability to do daily activities, but they should go away in a few days. And some people may have no side effects at all, and that's okay too. The vaccine is still working even if you don't have any side effects. All vaccines, including the COVID-19 vaccines, are capable of causing a severe allergic reaction called anaphylaxis. These reactions, however, are very rare. And if they do occur, vaccination providers have medications that are readily available to effectively and immediately treat the reaction. After you get the COVID-19 vaccine, you will be asked to stay at the site for at least 15 minutes so you can be observed in case you have a severe allergic reaction and need immediate treatment. Some people will be asked to stay to be observed for at least 30 minutes. For example, those people who have had allergic reactions in the past. Over-the-counter pain relievers such as ibuprofen, aspirin, acetaminophen, also known as Tylenol, can help to relieve any pain and discomfort you may experience after getting vaccinated. If you develop an itchy rash where you get the shot, certain antihistamines, for example, Benadryl, can be helpful. Talk to your doctor or pharmacist to find out which medicine might work best for you and to be sure you can take the medicine safely. There are some non-drug measures that can help to reduce pain and discomfort after a COVID-19 shot. If your arm hurts, try wetting a clean washcloth with cool water and placing it over the sore area. Moving your arm around also can help. If you feel feverish, be sure to drink plenty of fluids, water is best, and wear lightweight clothing. As we said, in most cases, discomfort from pain or a fever is a normal sign that your body is building protection. But it's best to contact your doctor or healthcare provider if redness or tenderness where you got the shot becomes worse after 24 hours. You also should let your doctor or healthcare provider know if your side effects are worrying you or do not seem to be going away after a few days. So you got your shot. Yay! What comes next? Your vaccination provider will give you a CDC vaccination card that tells you which COVID-19 vaccine you received, the date you received it, and where you received it. Keep your vaccination card in a safe place in case you need it for future use. Also, consider taking a picture of your vaccination card as a backup copy. Once you get a COVID-19 vaccine, you can enroll in VSafe using your smartphone. VSafe is a free tool that uses text messaging and web surveys to provide personalized health check-ins. Through VSafe, you can quickly tell the CDC if you have any side effects after vaccination. VSafe also reminds you to get your second dose if you need one. Your vaccine provider will give you an information sheet on VSafe that explains how to register and get started. You might want to go ahead and sign up for VSafe while you are being observed for 15 or 30 minutes after your shot. If you received an mRNA vaccine from Pfizer, BioNTech, or Moderna, you will need to get a second shot to be fully protected. For the Pfizer BioNTech vaccine, the second shot is given 3 weeks after the first shot. For the Moderna vaccine, the second shot is given 4 weeks after the first shot. You should get the second shot even if you have side effects after the first shot, unless a vaccination provider or your doctor tells you not to get it. Be aware that side effects after your second shot may be more intense than the ones you experienced after your first shot. Therefore, you may wish to schedule the shot on a day when you don't have to go to work or school the next day. As with any vaccination, it takes time for your body to build protection after you get the COVID-19 vaccine. You are considered fully vaccinated 2 weeks after the single shot Johnson & Johnson COVID-19 vaccine. You are considered fully vaccinated 2 weeks after your second shot of the Pfizer-BioNTech or Moderna COVID-19 vaccine. Until you are fully vaccinated, you should continue to take preventative measures such as wearing a mask and staying 6 feet apart from other people. After you are fully vaccinated against COVID-19, you can resume activities that you did before the pandemic. However, to reduce the risk of being infected with the Delta variant and possibly spreading it to others, wear a mask indoors in public places that can result in high transmissions. Thank you for attending the presentation on what to expect when you get the COVID-19 vaccine, developed by the American Pharmacists Association.